Morning. Thank you for joining us. Now, Abhay, could you walk us through what is happening to the COVID versus non-COVID business for hospitals? Because this, in a sense, is a quarter where, for the first time after 5-6 quarters, the non-COVID business is coming back.
So there's been a very swift recovery as far as non-COVID occupancy is concerned in the current or the preceding quarter, which is the second quarter of FY22. What we've seen is the occupancies are at about 75% compared to 73% at pre-COVID times, and less than 2% of our total occupied beds were COVID beds. So effectively, what that tells you is elective surgeries are back. They are back, to perhaps better than pre-COVID levels, and almost all of them are back. In spite of the fact, and this is a huge positive, perhaps going forward, that international business is yet to come back entirely. And in the second quarter this year, it was only 1/3 of our pre-COVID levels, and that number is ramping up significantly in the current quarter as we speak.
Abhay, now Max has seen a massive margin expansion from 15% to about 24%. Is there more scope for improvement on the margin front?
So, rather than EBITDA margins, I would rather guide you towards EBITDA per bed, which is a more relevant number, simply because, you'd rather do have a 20% margin on a 1 lakh rupee surgery than have a 50% margin on a 10,000 rupee surgery, right? The EBITDA per bed in the current quarter, in the quarter 2 FY22, was 55 lakhs. And this is without the Max Lab retail business or the vaccination business that we're speaking about. It's significantly higher than the peers, but at the same time, it's also significantly higher than the previous quarter, because this number in the COVID quarter was 45 lakhs per bed. And at the same quarter last year, it was about 26 lakhs per bed. So you can see a number of 26 lakhs per bed last year, moving up to 45 lakhs per bed in quarter 1 FY22, and now coming to at about 55 lakhs per bed in quarter 2 of FY22, in spite of marginal, I think, reduction that you see, which is visible as far as the EBITDA margins are concerned. So, simply because ARPOB is significantly higher as well. This quarter we had an ARPOB of 59,000 versus 51,000 in the previous quarter, and 46,000 in year on year, same time last year. And this is, like I said, in spite of international business, which is a high ARPOB business, yet to come back to its entirety. In the second quarter, in the current quarter, we see this number ramp up again.
Sure. Abhay, do you also see a upgrade or a change perhaps in the payer profile as well, with increasing insurance and savings-led affordability?
No, so absolutely. I think, we're extremely encouraged by what's happening in the insurance sector. There's been a huge proliferation of insurance policies, medical insurance people have purchased, and we are seeing that knock-on effect right away. The insurance sector, this particular payer segment for us has grown by about 25% plus over the last 1 year. And we see this secular trend continuing, coupled with the huge digital revolution which is happening, which is enabling us to reach more and more people effectively and efficiently. And from a high-end tertiary care hospital for like ourselves, all of these platforms being created augurs very well, simply because we're able to reach out to more people, and it helps us conversion towards our IPD, and that's where we really, the commercials work for us.
Right. So, Abhay, can we expect the hospital sector to actually post higher non-COVID revenues, say, in the coming 6 months?
Yeah, I think you've already seen it in this quarter without COVID. Like I said, COVID revenues were less than 2% of our beds were occupied by COVID versus 36% in the first quarter. So sequentially, 36% COVID beds, 136 crores of vaccine-related, COVID vaccine-related revenues, came down from 36% to 2% this quarter. The COVID revenues, as well as the vaccination revenues coming down from 136 crores to 91 crores. In spite of that, you've seen better EBITDA this quarter compared to last quarter as well. And this is largely on account of the operations. The business as usual increasing. And there's been a revenue increase of about 12% quarter on quarter sequentially. And the EBITDA increase of EBITDA increase of 12% quarter on quarter sequentially, and a 8% increase in revenue quarter on quarter. This is sans of course, this is without the vaccination related revenue, which were one time.
All right, Abhay, good luck. Thank you for